Welcome to State of Affairs. I'm Steve Adubato. We're coming to you from the Agnes Varus NJTV studio in Brick City, Newark, New Jersey. It's our honor to introduce, joining us for the first time, Dr. Clenton Coleman. He's affiliated with Holy Name Medical Center, and your area of expertise is?
Internal medicine and nephrology, which is kidney disease and high blood pressure.
But you're also very aware of, concerned about, and want to talk about the fact that race and healthcare directly related. How so?
With the United States, there's been some history of mistrust in the healthcare system. We know that black males as a demographic have the lowest life expectancy of any major demographic group. They're more likely to develop cancer, diabetes, and high blood pressure. And these are all preventable diseases. And they're also less likely to be involved in the organ donation process. The reasons for that are many. Partly it's education, lack of access to health care, or mistrust of the healthcare system. So, there's been a lot of race issues, and as we know, race issues in society have always paralleled race issues in healthcare, which has led to a mistrust of the healthcare system.
Let's break this down a little bit. We were talking before we got on the air. 13% of the population,
right,
African American. 4%,
yes,
of all physicians African American.
Right.
Why is that relevant?
It's extremely important.
By the way, why is the number so low?
Well, there's many reasons, right? And
sorry for asking two questions at once. Go ahead.
Yeah, but I preface to say that getting into medical school is difficult for everyone, right? So medical schools, as we know, have been segregated into the late 1960s. So with that, there's been a late start, and there's only been a few institutions that accepted black students to go into medical school.
Right.
There's also been cuts in medical education financing. Medical school is really expensive, so most students leave with about $200,000 in debt. Also, there have been shifts away from minority health programs and affirmative action. So these young, talented black children aren't able to go through medical school.
Opportunities aren't there.
Exactly, for many reasons.
So a patient who happens to be African American, he or she, and by the way, is it more African American men that are distrustful, if you will?
Definitely.
And would all things being quote unquote equal,
right,
big leap, big question,
yeah,
would rather have a doctor of color?
Definitely.
Because?
There's some studies that show that black males feel more comfortable when they're taken care of by a black physician. They feel more comfortable. They're more likely to comply with preventative care. And that the disparity that we talked about earlier is reduced by almost 20%. So it's a big deal. And not necessarily a black or white thing. I just think patients overall feel comfortable with the doctor, what they can relate to. They speak the same language. There's more trust, there's better communication, and less bias on both sides.
That's why it's important to have diversity in a medical staff.
Definitely.
Now, go back to something you said before. We work with the Sharing Network in the state of New Jersey in promoting public awareness around organ and tissue donation.
Yeah.
You said that the numbers of those who happen to be African American who are willing to say, yes, I will be an organ donor, is not what it should be.
Right.
Because?
Well, I think organ donation, it's on the same spectrum as this mistrust of the healthcare system on the part of black patients. There's two types of, I guess when you think of it two ways, there's a recipient and there's a donor. So, you're thinking from the perspective of someone who feels like they've been taken advantage of systemically. Why would they want to give their organ to a system that, they've really not gotten back much from? The recipient part of it is, there's clinical decision-making bias for certain diseases, meaning depending on your race, gender, or socioeconomic status, you're likely to receive less aggressive care. So for example, I'm a kidney doctor. Black patients are more likely to receive dialysis as opposed to a kidney. They're also less likely to accept a kidney because they don't trust the system.
Less likely if they've been waiting, they've been on the list 3 years, less likely to accept a kidney.
Well, they don't even want to get on a list because they feel like they don't, deserve it or what have you.
To what degree are you constantly talking to patients who happen to be African American and trying to talk through these issues with them?
There's a lot of cultural bias that we have to, so we need culturally competent providers to address this.
What that means. Say someone's not African American,
right?
But being culturally competent, not just in dealing with a patient who happens to be African American, someone who is Hispanic, someone who's Asian, someone comes from whatever part of the world, because we're such a diverse community.
We have to understand why patients do what they do. There's some background information, or there's a cultural. So, for example, nutrition is a real cultural basis. So, if, soul food, is common in the black community and is not the healthiest food. So you have to take that into consideration as well. Also, lifestyle changes like exercising, and that's not necessarily the coolest thing to do, but we're trying to change that dynamic and that thought process that being healthy, does mean eating better and taking care of yourself.
One more thing I'm curious about. The Affordable Care Act, a lot of political discussion in Washington around it. If the Affordable Care Act, otherwise known as Obamacare, were to be repealed in a significant way, you have argued that it would disproportionately impact the African-American community because?
Well, definitely. So the Affordable Care Act, there's more patients of different demographic groups who, socioeconomic status, who can't afford health care. They have more access to health care. If you repeal that, if you take that insurance away, then those set of patients won't be able to receive the care that they probably deserve.
Final question. By the way, speaking with Dr. Clenton Coleman from Holy Name Medical Center, I'm curious about this. You got into medicine because?
I like helping patients. I think that's the most basic thing you can do to help people, right? It doesn't boil down to anything. That's all we have is our bodies. So I think for me to give back to the community and help patients at an individual basis, that's what I live for.
And not understand the connection between medicine, healthcare, race, and racism is a mistake, is it not? Short-sighted.
We underestimate, race as it relates to healthcare system. You have the glaring examples like the Tuskegee experiment and gynecology surgeries on women without anesthesia. But there's so many other reasons for the development of this mistrust as we have to work to undo that damage.
Doctor, we thank you for being with us and talking about such an incredibly important issue. All the best.
Thanks for having me.
You got it. Stay right there. This is Steve Adubato. I'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by New Jersey Sharing Network, Delta Dental of New Jersey, Seton Hall University, the Northward Center, NJM Insurance Group, the New Jersey Education Association, and by New Jersey Resources.